A lot of us here in the Lowcountry have been touched by chronic kidney disease. Certainly I have. Great to get a chance to talk with Dr. Charles Vega and his friend Thelma about their patterns through all of this, through what is called the It Takes Two initiative for chronic kidney disease. Dr. Vega, you are the family medicine specialist and director of UC Irvine's program for medical education for the Latino community, but I'm sure the It Takes Two initiative involves everybody, right?
It absolutely does. In fact, about 35 million U.S. adults have chronic kidney disease, but only about 10% or a little bit more actually know that. So many times this disease is silent, and Thelma will share her story about how it starts with very non-specific symptoms, kind of hard to put your finger on it. But we're here today to advocate for screening, and that I'm in primary care. We want to go upstream and identify chronic kidney disease before it becomes symptomatic, because we have great treatments that really improve prognosis.
Okay, is it something that we generally get tested for when we go have our annual checkup with our doctor? Is it something we need to be asking for?
So there's no screening for all adults at this point to be screened for chronic kidney disease, but we see so many adults with hypertension, that's 45% of U.S. adults, diabetes, 13% of U.S. adults. Those are the two main causes of CKD. So if you have either of those conditions, you should be tested with both a urine test and a blood test at least once a year. If you have a family history of chronic kidney disease, if you have existing cardiovascular disease, you should also be tested. One thing that's really important to note, that cardiovascular risk increases with CKD. The two conditions are interconnected. So if you have CKD, it's not just a risk for dialysis or kidney transplant, which are really serious outcomes, but actually heart attack and stroke as well.
All right. Thelma, tell us your story. You are a two-time kidney transplant recipient. That's a mouthful right there. Talk a little bit about your journey with chronic kidney disease and where you're at now.
Well, my journey with CKD, it took over a decade in order for the doctors to find out that I had CKD. When I did present to my physician with swelling and fatigue, they pushed that off to another condition, and oftentimes that's what happens. But I went back a decade later with flu-like symptoms. They did a dipstick test in my urine, and it showed that I had blood and protein. And from there, of course, that's not supposed to be there. A biopsy showed that I had a rare kidney disease, but I was also diagnosed with type 2 diabetes, high blood pressure, high cholesterol, and everything spiraled out of control. So not only am I living with CKD, I'm now living with these cardiovascular kidney metabolic conditions on top of that, and it has been very overwhelming.
Is this a particular problem for minority folks?
Yes, unfortunately, the brown and black communities are disadvantaged with this condition because of the high risk of type 2 diabetes and high cholesterol and the high blood pressure.
Dr. Vega, you all have a website, testyourkidneys.com, which provides an awful lot of information here. But tell me what I should be doing and what everybody who maybe has some of these underlying conditions should be doing the next time we go in and talk to our doctor.
Yeah, well, testyourkidneys.com, which is co-sponsored by Boehringer Ingelheim and Lilly, who are great partners in this public awareness campaign. It's a great place to start, but don't be afraid to have the conversation, especially when you look at your medications, you're taking something for blood pressure, you're taking something for diabetes, either one, right there, you really need that blood test and urine test on a routine basis, because trust me, I have many patients. I've been in the same practice at a SafeNet clinic in Orange County for many years. We've been able to, yes, CKD is present, but it's never delivered any symptoms, and certainly none of the big outcomes like dialysis, because we're able to control it from the get-go. When we go upstream, better things happen.
All right, it's called the Take Two Initiative. Again, testyourkidneys.com. Really simple website to remember. Dr. Charles Vega and Thelma, we appreciate your time, and have a great holiday. We appreciate it.
Thank you. You too.
Thanks to everyone on the show today for their insights and contributions. As always, our production team is behind the scenes to make all of this possible. And of course, we are honored that you have chosen to share part of your day with us. I'm Betsy McDaniel, and we'll see you for the next WHHI-TV Daily News.